Tonight's keynote speaker is Dr. Irminne Van Dyken. She's a surgeon at Queen's Medical Center on Oahu in Hawaii. She got her medical degree from the University of North Dakota School of Medicine and Health Sciences. She's Dutch. She's from Holland originally. But she somehow always dreamed of living in Hawaii, and she went for it. So she lives on Oahu now, which I think is a very good move. And she's a full-time surgeon who lives with her husband, Russell, who's with us this weekend as well, along with her dog and her 2 cats. And an interesting piece of trivia is that she's been vegetarian since the age of 9, and it gives me great pleasure to welcome and to introduce her to you, Dr. Van Dyken.
Hello, everybody. Good evening. Thank you so much for coming. And I want to start off with talking to Jeff and Sabrina specifically. Thank you for putting this on. This is such a beautiful thing. Not much will get me to leave Hawaii, but this for sure will. So, again, you guys, I'm so happy you're here. You being here shows me that you have initiative, that you have the impetus, you want to change, or you want to be healthy in your lives, and that to me is priceless. So again, thank you. I'm a surgeon. As a surgeon, I cut. That's my job. That's what I'm trained to do. Unfortunately, when I meet most of my patients, they are well into their disease. It's terminal. They really don't have many options as far as lifestyle changes are concerned, diet is concerned. Oftentimes, surgery is the only answer for them. What's heartbreaking to me is many of these patients have conditions that could have been prevented, treated, even reversed with lifestyle changes and dietary changes. That to me is my goal in life. I want to see people, I want to see patients take the motivation to ask me questions, to change their lifestyle, to try to prevent things. I want to see this new age of patients actually getting in the driver's seat and taking control of their own healthcare and their own lives. You won't hear this much, but my goal in life is to put myself out of business. I'm serious. I want to not have to do surgery on all these people. I want people to be changing their lives and avoiding surgery. If I can do that, that will make me happy and I'll feel accomplished. So without further ado, let's get started. I came up with a list. 10 ways a plant-based diet will help you avoid the scalpel. This is my list. It's not published anywhere. It's what I felt was important and what I felt were the 10 most common ways that a plant-based diet will help you avoid the scalpel. So let's get started. Leading causes of death in the United States in 2014. We have 10 leading causes. 2 of them pretty much account for most deaths. Any idea for the #1 leading cause of death? You guys are good. Okay, heart disease is #1. How about #2? Cancer. Good, good. And then we have some other ones. Chronic respiratory disease is #3, so that's asthma, bronchitis, emphysema, a lot of that caused by smoking. And then we have everything else, accidents, stroke, etc. All of these account for our deaths in 2014. But if you look at this yellow bar, this is over 80% of all of the causes of death. These are preventable. These are all preventable with lifestyle changes, and that's what I want to get across to people. So let's take a step back. 100 years ago, 1900 versus 2010. Leading causes of death in 1900. Any ideas? I know the slide's hard to read back there. So infections, things that will take you over, tuberculosis, pneumonia, GI infections. Those were the leading causes of death in 1900. Now fast forward to 2014. Leading causes of death for that, you've got heart disease, you can see is #1. Cancer, you can see is #2. That was pretty much non-existent 100 years ago. Why is that? Any ideas? What changed in these last 100 years? Diet's a big one. What else? Yeah, lifestyle. We're a lot more sedentary than we were. We don't exercise like we used to. We're not working on the farm like we used to. We have desk jobs. That's changed. So there's a lot of things that have changed in the last 100 years. BMI, 100 years ago compared to now. So BMI is body mass index. That's how we measure, it's a crude measurement, but that's how we measure obesity in this day and age. If you look 1900, you have a pretty low body mass index. That counts as a healthy body mass index. Fast forward 100 years, you can see the average body mass index is way up there. You're at 26, 27, which is considered obese. If you look at this overlay here, you can see overweight is about 25 to 29, and obese is going to be above that. So in 100 years, not only has our diet changed, not only do we have more heart disease, et cetera, we have a higher body mass index, more obesity. So in my office, patients come to me, they're feeling sick, they have a problem that is preventable. I tell them, well, there's something we can do about this. I ask them, I say, is there something, if I could tell you that there's one magic pill, just one pill, a silver bullet pill, if you took that every day for the rest of your life, you may prevent any disease that you could come across, or almost any disease. My patients, their eyebrows go up, they say, what, you have a silver bullet? You have a magic pill? Well, I tell them, yeah, I do. And the answer is this: a whole food, plant-based diet. That's the answer. Yes, you need to learn how to do it. Yes, it involves a lot of changes, but this is the silver bullet. This is going to prevent so many illnesses in our day and age. 2 small disclaimers before I get started. I'm here talking about a plant-based diet. There's a few things we need to know. This does not apply to junk food. You can be vegan, you can be plant-based, and you can still be a junk food addict. French fries are vegan. Are they healthy for you? Absolutely not. There are other things that are vegan. Oreos, not healthy for you. So this applies to whole foods, unprocessed foods, things that our grandmother would have eaten, things that are very plentiful in nature, okay? Disclaimer number 2, exercise. We cannot talk about diet and lifestyle changes without talking about exercise. Exercise is huge. Any exercise we do potentiates the effect of our diet. It's exponential. So always remember, exercise when you can. So moving on, this is me in surgery, doing what I love to do. But like I said, I'd be happy if I was put out of business. If I could not have to do surgery for this kind of thing, for preventable diseases, I would be very happy. Starting with our list of 10. Number 10, I said, the number 1 killer of Americans, heart disease, we'll start there. Let's avoid atherosclerosis, the cause of atherosclerotic heart disease. Heart disease, leading cause, we talked about that. It kills over 611,000 people in the US last year. That's a lot of people. Atherosclerosis is very well known to be a direct effect of inflammation, cellular stress, cholesterol, and plaque buildup. These are things that are easily reversible. So how does atherosclerosis work? Starts when we're very young. We have what's called a fatty streak, a little white streak in the inside of our arteries. It progresses, goes on to endothelial dysfunction, which is dysfunction of your cells, and then it progresses even more, and you get plaques. Here's a picture. It's of an autopsy, so it's of somebody who's dead, been dissected. You can look at the inside of their aorta there. That black arrow points to a white streak. That's a fatty streak. This is the beginning of atherosclerosis. Any guesses on how old this person is? About 15 years. So basically, we have found on autopsy studies 15-year-olds, 15 to 20 years, are developing fatty streaks. The beginnings of atherosclerosis happen at a very young age. This comes from a very well-known vascular surgery textbook. Plaques progress. You get inflammation, progresses your 3rd decade to your 4th decade. Then you've got this unstable plaque, ruptures. And when it ruptures, it can occlude your entire blood vessel. Depending on where that blood vessel is, you get a certain problem. If it's in your heart, that's a very big problem. A little hard to see this picture with the lighting, but this is also an autopsy specimen of a heart. This person had a blood clot, a plaque that ruptured in the LAD, the left anterior descending. This vessel is known as the widowmaker. That's what it's nicknamed. This supplies a lot of blood to your heart muscle. When you get a clot there, you get a very bad heart attack. And as you can see here, The area of heart attack, that lower portion of the heart where it's all dark and brown, that's dead muscle because there's no blood supply. In medicine, we study the blood vessels in the heart. We do what's called an angiogram. We access the vessels in the groin, the femoral region. We put a catheter up, we shoot some dye in, and we're able to see these blood vessels, any areas of narrowing, and we're able to treat them accordingly. As you can see here, this white arrow corresponds to a narrowing. This is something we need to treat pretty quickly. And it's a narrowing again, right where the LAD is. So this, conventionally, we treat a couple of ways. We blow it up with a balloon, we can put a stent in, or we do bypass surgery. Very extreme. Bypass surgery, cracking open the chest, opening things up, finding this blocked vessel, bypassing it to get more blood supply to where it needs to be. It's a very gruesome procedure, and these patients have to go through a lot. High complication rates. Costs about $150,000 for one of these surgeries. That's pretty cheap. They're costing more and more these days. But the kicker is, you can go through all this life-threatening surgery. There's still a 15 to 30% chance that this graft, this brand new blood vessel, can clot up within the first year if you don't change your lifestyle habits. So I can think of a few more things that are less extreme than bypass surgery that might help decrease the chance of coronary artery disease. This guy, Dean Ornish, I don't know if any of you have heard of him. He's one of the groundbreaking people in this field. He did a lifestyle heart trial. He took patients that were so sick from their coronary artery disease. These were patients that the cardiothoracic surgeons wouldn't even operate on because their risk was so high. In surgery, we have a saying. If you have a patient that's very sick, we say they're not even fit for a haircut. They won't even tolerate a haircut. Well, these patients would not tolerate a haircut. They were very sick. Dean Ornish took these people, and he put them on a strict regimen. He had his Ornish program. So he had dietary restrictions. Not only that, but he also did lifestyle changes. So a lot of exercise, meditation. His diet was pretty strict, and you can see it outlined up there. 10% fat, 15 to 20% protein, 70 to 75% carbohydrate, and then restriction of cholesterol. And he took these patients, he followed them. 82% of them had regression of their coronary artery disease in 1 year. That's huge. These are people that wouldn't even be touched for surgery, and they had regression of their disease. I don't need to talk much about this guy because he's coming tomorrow, and I'm sure he's going to tell you himself all about what he does. But he also, one of the groundbreaking researchers in this field. He just published this. This was last year in the Journal of Family Practice. So this is a journal that goes out to family doctors, to the basic doctors. And what they do is they look at this and they are coming up with recommendations for their patients. This paper right here is talking about lifestyle changes as a first-line method to prevent cardiovascular disease. It's before statins, drugs, before all these other drugs. He's saying this is the first-line method. This is exciting. This means it's getting into the mainstream, which is very good. So Dr. Esselstyn studied this. He studied the coronary arteries. This picture that I have up here, see if I can point to it. Here is a coronary artery. You can see a blockage there, that dark area that's not lighting up on the PET scan. After putting people on his diet, 21 days. It's not very long. 21 days he saw this. He saw complete revascularization of the coronary artery. Remember the angiogram study that I showed you before? Here's another one. The LAD, completely blocked. You would think this needs a stent. This person really needs some sort of intervention. Well, Dr. Esselstyn put him on a plant-based diet with his regimen. Look at that. It looks like there was a stent. It's completely open. Granted, this was some time. This was 32 months later, but beautiful results and encouraging results. I cannot talk about plant-based diet and health conditions without talking about the EPIC Oxford study. EPIC Oxford study is very well known. It was conducted at Oxford, and it studied about 500,000 people all in all. There were different avenues. There's been hundreds of papers written on this patient population. And what they do is they study everything. This paper in itself, it's a little cut off up there, but they're talking about risk of hospitalization of ischemic heart disease between vegetarians and non-vegetarians. And they did a graph, fancy little things. Basically, what they're showing is the vegetarian diet is much better in preventing hospitalizations for coronary heart disease. So that's number 10, heart disease. We're off to number 9. What was the number 2 killer in America? Yeah, so let's talk about some of that. I'm going to start with breast and prostate cancers. Those are the most common cancers in the US population. So if we look at cancers, among the men, prostate will be the most common. Among the women, breast is the most common. These are new cases diagnosed in 2014. Following that, you have lung cancer, and then you have colon cancer. So the big ones I want to focus on today, breast, prostate, and colon. This organization, the American Institute for Cancer Research, they're a well-funded organization. Every year, they put out an update to this paper, Food, Nutrition, Physical Activity, and the Prevention of Cancer. There's a lot of good information in there, and their populations and their guidelines are very well studied. Here's a quote that came from them. Diet can reduce the incidence of cancers by approximately 1/3. And then another 1/3 can be prevented by abolishing smoking. So you think about that. 1/3 of cancers prevented by stopping smoking, 1/3 by diet. That's 2/3. 2/3 of all cancers can be prevented just by dietary changes and smoking. That's fantastic information, and it should be very empowering. So this group, the AICR, came up with 10 recommendations for cancer prevention. These are well studied. These are tips that I would encourage all of you to take into mind. So number 1, be as lean as possible without becoming underweight. This is important. Studies show that people that are underweight, it's a deleterious effect. They have a higher risk of malignancy. So you don't want to be underweight, but you don't want to be overweight. You want to be just in that right area. Number 2, be physically active for at least 30 minutes every day. So you limit your sedentary habits. Number 3, avoid sugary drinks. Limit consumption of energy-dense foods. High fructose corn syrup, artificial sweeteners, that all falls in this category too. You want to avoid that. 4, eat more of a variety of vegetables, fruits, whole grains, and legumes, such as beans. So make sure you're getting your legumes and your beans. 5, limit consumption of red meats. If there is anything stronger between cigarettes and a cancer connection, I would have to say it's red meat. There's a lot of good data showing red meat has been very well linked with many different cancers. Number 6, if you consume them at all, limit your alcoholic drinks. So 2 per day for men and 1 for women. Number 7, limit consumption of your salty foods or foods processed with salt. Number 8, don't use supplements to prevent against cancer. Supplements are an interesting thing. There was a fad a while back where people thought that supplements would prevent cancer. The vitamin E supplements, the vitamin D supplements, people were taking these supplements like candy. And studies show that they actually increase your chance of cancer. So avoiding supplementation, getting your vitamins, your nutrients from whole foods, much better than taking supplements. 9, if you are a mother, it's best for you to breastfeed for up to 6 months and then start working in your other liquids and solid foods. 10, after treatment, people that have had cancer and get treated, the recommendation is they continue to follow all these guidelines. That's very important because people who are cancer survivors have a risk of recurrence and a risk of other cancers in other locations. So for them to follow these guidelines, the best thing they can do. Okay? The red meat and cancer, this isn't a new idea. It's been around for a while. I dug this up. It was published in the New York Times in 1907. long time ago. And the headline reads, "Cancer Increasing Among Meat Eaters." And they go on to talk a little bit about it. For some reason, the idea, it never took off. It was kind of forgotten about until recently. Now we've got a lot more data, a lot more good information that finds this connection important. Anybody know who this is? Yeah, you guys are well educated. I'm probably telling you stuff you already know. In any case, this guy hails from North Dakota, which is where I did my medical training, so I shout out to North Dakota here. He publishes a lot. He does a lot of research, as you guys know, on diabetes, other medical conditions, but he also does some cancer research. And this publication came out, and it's applying the precautionary principle to nutrition and cancer. And essentially what he's saying is you can use diet as a precaution, as a preventative agent for these cancers. So focusing in real quick on breast cancer. I treat a lot of breast cancer. A lot of women who find me, they're high risk for breast cancer, high risk for problems like that. A lot of this is so preventable. Breast cancer feeds on estrogen. It's hormone dependent. Estrogen is something that we can control in our bodies, whether we know it or not. The obvious things, right, are going to be birth control pills, oral contraceptives, but other things, such as limiting the amount of fat cells in our body, we may not think of so much. Strong correlation between lower obesity rates, less fat in your body, and breast cancer development. So of course, that's been published many times. You reduce the risk of breast cancer by nutritional strategies. You reduce your risk of taking in all these phytoestrogens, estrogens, and it can help you prevent breast cancer. Remember those 10 guidelines I showed you that follow these 10 things? This is a paper looking at that with breast cancer. Adherence to these guidelines, do they make a difference, or are they all just a bunch of hogwash? Well, this paper says, yeah, it does make a difference. And another one says the same thing. Essentially, what they're saying is that if you follow these guidelines, you're going to have a decrease in your cancer rates. You're going to see the mortality of cancer being lower. And the more guidelines you follow, the better outcome you have. People that already have breast cancer, they need some guidelines as well. They need some help. And I have to talk again about exercise because it's one of my little babies that I'm nurturing is exercise in these women that are going through breast cancer. Studies show exercise is going to help decrease your recurrence rates, decrease any of your relapses. This is a study done on boot camp. You guys know what boot camp is? It's kind of this workout starting to become the rage. People are really, it's a hard workout, and it's to get you into shape really quickly. They have like wedding boot camp workouts and all that. But this one, specifically for breast cancer patients, they put them through this boot camp, and then they looked at their survival and their tumor characteristics. And interestingly enough, they found that the tumor characteristics actually got more favorable. So Ki-67 is a genetic thing we look at with breast cancer. We look at the cells. The lower the number, the better your prognosis, okay? So when we're looking here, Ki-67, this is before they started boot camp, this is after, dropped, which is a good thing. Directly correlates with the BMI, their obesity rates. So when you go to boot camp, you're losing weight, you're also getting a better prognosis from your breast cancer. Very interesting stuff. That was done in Texas. The research that we're doing here in Hawaii is very exciting as well. You guys know hula dancing? Very Hawaiian, right? We have our women with breast cancer, and we're having them go to hula lessons. Go do hula dancing. That's their exercise, and they absolutely love it. Our study just closed. We're just looking at all the numbers, but interesting stuff. And we're finding that these women are having better survival rates and a higher quality of life. And that may be to do just with the camaraderie with other women, learning hula together. It's fascinating stuff. So on to prostate cancer. I could go in detail again about all the ins and outs of prostate cancer. Interestingly enough, it's a lot like breast cancer. It's also very hormone responsive, something that we can treat. So the same principles that we have for breast cancer, we can blanket apply for the most part to prostate. Dean Ornish, again, most of his research these days is changing more towards prostate cancer, which is a very fascinating thing. He took patients that had prostate cancer, and he put them on his Ornish program, which we talked about. It was not only diet, which was very strict, but lifestyle changes, meditation, yoga, etc. And then he had a control group. And what we find here is that patients that had the control group here, they only had a little bit of a regression of their prostate cancer. The ones that did the experimental group, the Ornish program, 70% improvement in their prostate cancer. So data-driven strategies to prevent prostate cancer. These are adapted from Dr. Joel Fuhrman, so credit is given to him. Number one, you want to eat a whole foods plant-based diet. Green leafy vegetables, mushrooms, berries, seeds, tomatoes, cooked tomatoes, lycopene. Lycopene is a very powerful substance in fighting prostate cancer. And then you want your carotenoids, your yellow and orange vegetables. Next, you want to get your folic acid from whole foods. This is important. You don't get this from supplements. So one of those other things again, folic acid, if you get it in your diet from green leafy vegetables, great, helps fight prostate cancer. If you get it in a supplement form, it actually increases your cancer. So it's counterproductive. So avoid the supplements. Avoid fried foods, it's a given. Exercise at least 3 hours a week. And then lastly, this one kind of is a supplement because it's hard to get this amount in your diet, but you want to supplement with just a little bit of zinc, conservative amount. So adequate levels are protective for that. So that's prostate cancer, breast cancer. We've gone through the number 1, 2, 3 killers in the US. We're going to go to number 8, still a cancer. This is the other one of the things that I treat a lot. That's colon cancer. Entirely preventable and actually detectable pretty early. Any of you guys know what a colonoscopy is? Been through it? Done it? Yeah, it's not that much fun, but it does detect cancer early. So what we're looking at here is the inside of the colon of one of my patients. Normal colon is this beautiful pink ripply wall here. That's what we love to see. And what we're seeing here, this right there, is a big ugly colon cancer. One of them. Now this one is one we cannot remove endoscopically or with the colonoscope. This patient's going to need surgery, which is a big deal. Going through surgery, high risk, healing from it. These patients have to go through a lot, which again is heartbreaking because it is preventable, very preventable. So study published talking about lifestyle modifications in colorectal cancer, again, highlights that link that I was talking about. Red meat consumption, processed meat intake. So the processed meats, like the lunch meats, the hot dogs, that sort of thing. Probably one of the worst things that you could put in your body when it comes to colorectal cancer. This is another one. Published study on red meat, sorry the top's cut off, and colorectal cancer incidence. It's a meta-analysis, and they're talking about risk factors, connections with red meat and colon cancer. And what they come up with is the high intake of red and processed meat is associated with significant increased risk of colorectal and colon and rectal cancers. So evidence supports that you prevent red meat in order to decrease your cancer rates. How is that? Why is there such a strong association? Well, there's a few plausible mechanisms. When we throw meat on the grill, we're going to get these heterocyclic amines. These come from grilled, barbecued meat. And when those are released, they actually are carcinogens. Additionally, this is really fascinating, and it's about the microbiome. I don't know how many of you heard about the microbiome. I'm going to be talking about it in detail tomorrow. But this meat, you can eat this red meat, and you have certain bacteria in your gut that kind of metabolize the meat. They release a certain gas and a certain compound. The compound they release, not the meat itself, but the compound that the bacteria release is carcinogenic and can cause cancer in your colon. So preventative strategies. I'm going to go through these one by one because I feel they're very important and they are related to a very common cancer. So fiber-rich foods, fiber I'm going to harp on. Today, tomorrow, when I talk, fiber is probably one of the best things that you can do. It's easy to do, it's simple, it doesn't cost a lot, and the benefits are amazing. Fiber has anti-cancer phytochemicals. You can get fiber, green leafy vegetables, onion, garlic, citrus fruits. The EPIC study, the Oxford EPIC, the one that I talked about that was very important, they looked at 500,000 people, 500,000 people. They analyzed their fiber intake. And what did they find? They found that if you double your fiber consumption, you can decrease your rate of colon cancer by a lot, by 40%. So that's a huge number. That's kind of like that silver bullet pill. If I give you a pill, it'll decrease your rate of colon cancer by 40%. I mean, how many people want that pill? That's a good pill. So all it is fiber. On to B vitamins, folate. B vitamins are very important, not only for our colon cells, but for the bacteria that live in our colon. So the folate, low levels, actually allow colon cancer cells to become more invasive. A high intake of folic acid is going to reduce your risk of colorectal cancer and adenomas, which are like a pre-cancer that eventually will turn into cancer. Remember what I said about the supplements, the folic acid, the prostate cancer? Same rings true for colon cancer. Don't supplement, don't take a folic acid supplement. You want to make sure you get it from whole food. Grapeseed is another one. Grapeseed is a powerful antioxidant. It's rich in polyphenols. Studies show it inhibits a lot of chemicals that are pro-cancer chemicals. And they've actually done some studies on cell lines that show that it can reduce the production or the productivity of these cancer cells. Moving on to milk thistle, psilocybin is the chemical term for it. It's also chemopreventive, prevents colorectal cancer by targeting DNA mutation mechanisms. It's fantastic stuff. It promotes apoptosis, so it promotes programmed cell death of these cancer cells. So basically, if we have a cell that turns into a cancer cell, it's tagged and it is destroyed right away. And this actually enhances that. This is one of my favorite chemicals in the world. Probably no organic chemists out there. Anybody know what this is? Yeah, I don't expect you to. But what it is curcumin, turmeric. You can get this from Whole Foods, whole turmeric root. You can grate it on your salad. You can eat it as a whole food, and it is amazing. The benefits of this outweigh the benefits probably of anything I can talk about today, with the exception of fiber. So it's a very, very important thing. It has so many well-known chemical pathways. It's being very well studied right now, not only for cancer prevention, but for reducing inflammation and for many other things. So molecular targets, as I was talking about, they're plentiful. Seems like this curcumin is acting everywhere, and it's not toxic to normal cells. It strengthens your normal cells, but it's toxic to inflammatory cells, cells that cause your immune system to go into overdrive, cells that turn into cancer. It's very fantastic stuff. So you can see here, I know the text is small, my apologies, but there's all these different targets here that curcumin acts on. Transcriptional factors, growth factors, proteins, inflammatory cytokines. It's very exciting stuff. And the research on it is very new, which makes it even more exciting. This quote seems to sum it up pretty good. It says, curcumin seems to be one of the most promising, widely available chemopreventative agents which reduces colorectal cancer risk. Yes, we need more studies, but it is very promising.
Can I say something?
Yes.
I was at Whole Foods getting some curcumin, and the guy there said that they're finding out there's so many benefits. He said the pharmaceutical companies want to get their hands on it now.
Yes. You're absolutely right. I'm going to repeat that for those of you that didn't hear it. She said she was in Whole Foods, and she was told by the guy there that the pharmaceutical companies are actually very interested in this compound because there's so many different potential points of action. And yes, I mean, if I could buy stock in anything, it would be curcumin, because I think it is going to be the next big thing. Here, is what we've already found. This is only the stuff that we found in research and we're actively looking into with curcumin. So you're looking at, treating nephrotoxicity, colitis, all these cancers, inflammation, asthma, autoimmune diseases. It's very, very interesting field of research for sure. So moving on, one more compound. Anybody know what that is? Epicogalactocacectin 3 gallate? It's green tea. Green tea is fantastic stuff. It's also something that we're really researching, and there's a lot of good evidence out there. So we know it's a strong antioxidant. It prevents formation of reactive oxygen species, which are bad. It decreases your expression of growth factors that help cancer grow. So it's also a good thing to use if you are looking at preventing cancer. And there's good data that shows that it prevents colorectal cancer. Can't talk about preventing colon cancer without talking about alcohol and tobacco. It's important stuff, and these are carcinogens. Alcohol, you want to limit your alcohol intake. So if you are taking over 30 grams of alcohol a day, your rate of cancer goes up quite a bit. If you bring it up to even more, 45 grams a day, it goes up even more. Why is that? Alcohol is metabolized in our GI tract into acetaldehyde. Acetaldehyde is a direct carcinogen. It's been classified as a class 1 carcinogen. Another reason it can cause cancer is that alcohol intake actually suppresses our B vitamins, the folate that I talked about, the one that actually prevents cancer. Alcohol suppresses that. We can't absorb our B vitamins when we have that alcohol in our system. And then lastly, tobacco. It's an obvious one, but it is a really huge thing. Tobacco causes more cancer than anything. So back to physical activity. They studied physical activity in colon cancer. And if you are an active individual, you are going to decrease your risk of colorectal cancer by 24%. That's a lot. How does that work? Well, we have decreased insulin resistance, lower insulin levels, decreased body mass, so decreased obesity, and then we have decreased fat, decreased adipose tissue volume. All those adipose cells, those fat cells, directly correlate with inflammation. When you have inflammation, you have cancer formation. So we're on to number 7. We're going a little slow, I promise it speeds up. Number 7 is avoid obesity. A lot of this becomes very, very cyclic and repetitive. I feel like I'm repeating myself over and over again. Exercise, eat healthy, avoid obesity, but they're all intertwined. And the way to avoid obesity is going to be eating healthy, eating your plant-based diet. Patients that are obese, or people in general that are obese, are going to have a higher risk of cancers. You can see these cancers are tied with obesity. If you're an obese male, you have a higher risk of having esophageal cancer, colon cancer, liver cancer, pancreas cancer, and prostate cancer. Similarly, females, same thing. Higher risk of endometrial, gallbladder, breast cancer, pancreas cancer, and colon cancer. So controlling obesity is paramount. Now, I have patients in my office, and in Hawaii, a lot of the native Hawaiians tend to be a little more obese. They're just on that obese side. This is a CAT scan. Have you guys looked at CAT scans before? Essentially, a CAT scan is a way that we can look at the inside of a patient's body. And what we see here is my patient. This white circle here is the abdominal cavity, and all this black is fat, subcutaneous fat. It's to the frame, to the edges of the picture there. And what we have here is a cross-section. So if you imagine the patient's laying on their back and the machine's taking slices of them like a slice of bread, you can kind of look at it from the inside and you can see all the inside structures. Now my patients say, "Doc, you don't get it. I'm just a big person. I'm big boned. I'm not fat. This is how I am. This is my genetics. I'm big boned." And then we pull up the CT scan and it shows these little white stripes here. Those are the pelvic bones, the big pelvic bones. And you look in that body, that's way too much subcutaneous fat, intra-abdominal fat. It's an epidemic. little bit of poor lighting, but fat for me makes my surgeries hard. They become so challenging. I have to dissect through these fat planes, find the tissues that I'm working with. It makes my surgeries longer. Yes, there's more bleeding. Complication rates go up. If you are an obese person needing surgery, it's a much bigger deal than if you're not obese. As you can see here, this is a gallbladder. Again, it's a little dark, and my apologies. A gallbladder, the liver's up here, and this is all fat. It really shouldn't be there. I shouldn't have to be digging through this to find the structures I need to do my surgery. This is a close-up of that same patient's liver. Our livers can get replaced with fat cells, just like any other area in the body. Our livers, when they're replaced with fat cells, it becomes a big deal. It's called NASH, non-alcoholic steatohepatosis. We get inflammation, we get progression. So our liver cells get replaced by fat cells, then we get progression, we get cirrhosis and fibrosis. Cirrhosis is a term we normally think of people that are alcoholics, right? They drink a lot of alcohol, they get fibrosis, they get cirrhosis, then they have liver failure. You either need a liver transplant or you end up succumbing to your liver failure. Experts are predicting by the year 2050, the leading cause of liver transplant is not going to be cirrhosis from alcohol or hepatitis C. They're predicting it's going to be fatty liver, this NASH. This is a big deal. This is a big epidemic, and it's an unwanted byproduct of our obesity and our lifestyle. So as I was talking about, it wasn't just me making things up. Body mass index does predict your operating time in colorectal procedures. It also predicts your risk of complications. This paper here says chances of bleeding are higher, chances of wound problems, chances of infection, all higher in patients that are larger. And obesity is tough. It's a very, very tough problem. It's this wheel, this self-feeding wheel. You have increased energy intake, you're eating, then you have excessive weight gain, then you're less active because you're larger, and then you have reduced appetite control, and it's just a self-perpetuating cycle that feeds on itself. This is a study that was done on the Adventist group, and what we're looking at here is BMI, so body mass index, and your diet. It's very simple. People that eat whole foods, plant-based, have a much lower body index. You're looking at about 20, 21, 22. People that eat everything, you're looking at much higher. Any Japanese readers in here? No? Okay. Anybody heard of this saying? Hara Hachibu? Dan Buettner wrote a book called The Blue Zones. If any of you guys have not read that, I highly suggest you do. Dan Buettner with National Geographic went and looked at populations in the world, the populations that had the highest chance of living to 100. So the highest proportion of people that were what we call centenarians. And he found about 10 places in the world. One of the places where people live the longest was Okinawa, Japan. Then he went and he studied these places. He said, well, what's different in Okinawa, Japan than in LA? Why are people in Okinawa living so long compared to where other people live? And he isolated a few things. First off, Okinawans are mostly whole food, plant-based people, occasional fish every now and then. A lot of Okinawan sweet potatoes, which are very tasty. The other thing is in their culture. They have this saying. This is so ingrained in their culture. Hara Hachibu. It essentially means you stop eating. You stop eating when you're 70% full. Just stop. Once you get that technique down, you're not eating everything that's on your plate. You're not overeating. Your caloric intake goes down. So this is something that's ingrained in their society, and I think helps with their obesity rate and subsequently their longevity. So that was number 7, avoiding obesity. Number 6 is going to be next, and I'm going to harp on fiber, my favorite thing. So to avoid the scalpel, if If you can eat more fiber, you're going to reduce your risk of constipation, you're going to reduce your risk of hemorrhoids, and your risk of diverticulitis. Those are 3 things I see a lot in my practice: constipation, diverticulitis, and hemorrhoids. So fiber, it's been nicknamed the broom that sweeps the colon clean. It's so true. Fiber is something that absorbs everything, all the toxins in your colon, sweeps them out. So fiber is going to lower the incidence of all these things: hemorrhoids, certain cancers, as we talked about before, obesity, heart disease. It's going to lower your cholesterol, and it's going to help with your blood sugar control, with your diabetes. Moving on to hemorrhoids. These are the scourge of my patients' existence. I see so many of these, and they're miserable. My patients are miserable. And on the flip side, if we get their hemorrhoids under control, they're the most grateful patients in the world. So, over 3 million cases in the US annually of hemorrhoids. Hemorrhoids happen for many reasons, but what they essentially are these vascular plexuses here get enlarged, and they protrude from our rectum, and they become very, very painful. They can become exacerbated, irritated by constipation, by hard stools. This is one of my favorite quotes. The common people call them piles. The aristocracy call them hemorrhoids. The French call them figs. What does it matter, so long as you can cure them? This is from 1300. Hemorrhoids have been a problem. They've been around for quite some time. We see a lot of artwork, a lot of ancient artwork, but medical artwork, it's limited to hemorrhoids and maybe a couple other conditions. This is medieval times. Treatment for hemorrhoids was lancing them. I can't imagine that that would be comfortable. And the same, another piece of ancient art. Then we have the early 1920s where somebody tried to sell this. It's called the rectorotor. Rectorotor. It's a DIY fix hemorrhoids at home contraption. I'm not sure how that worked. In any case, I can't say that our surgical procedures today are much better. This is a procedure I do in the operating room. We basically staple the hemorrhoids, remove them, patient goes home, but the patient is miserable for about 3-4 weeks. It's one of the worst surgeries you can go through. So if we can prevent this, that is probably doing a big favor for people. So risk factors for hemorrhoids, one of them is going to be less fiber, right? Low fiber diet causes constipation, hard stools. This whole American idea of one well-formed bowel movement every day, maybe every other day, is probably not the best for our guts, not the best for our hemorrhoids for sure. So by increasing fiber, we can lower our problems with hemorrhoids. Moving on to diverticulitis. Diverticulitis is also a pretty common problem. It's when we get these little pouches in our colon. These little pouches can harbor bacteria, little balls of stool. They can get inflamed, and it causes tremendous pain. Anywhere in your colon, but most frequently in the left side of your colon. Affects 200,000 to 3 million cases in the US a year. It's a disease of Western civilization. You look in Africa, any of these less developed countries, diverticulitis is unheard of. They eat a lot of fiber there, they don't have diverticulitis. Not a problem. And that correlation with this low fiber diet is all throughout the world. This is an autopsy specimen, so you can see what diverticuli look like a little better. Little outpouchings. And as you can see on the bottom, these outpouchings contain stool, germs, can get inflamed very, very easily. When they get inflamed, they can perforate or they can bleed. That becomes a surgical emergency. So preventing all this is going to put me out of business. When I do this emergency surgery, I have to cut out that area of colon. Oftentimes it's not safe to hook them back together, so I have to leave them with a stoma. These are not fun. Not fun to have. You lose a lot of dignity with them. Anything to avoid this would be great. So, that EPIC 100, those studies, those people from Oxford, we got the study, we studied diverticular disease and diet, and they found a strong correlation between high fiber diet and a lower risk of being hospitalized for diverticulitis. So that's number 6. Moving on to number 5. Have more constant blood glucose levels, thereby avoiding diabetes and the complications of diabetes. You might think I'm a surgeon. Why do I care about diabetes? I mean, why? How is controlling your blood sugar going to help avoid the scalpel? It absolutely will. I see so many complications of diabetes. Risk factors for diabetes. Small text again, my apologies. Risk factors are going to be cardiovascular disease, high blood pressure, overweight, obesity, high triglycerides, high cholesterol, smoking, alcohol intake, and height. Out of all of these risk factors, every single one except for one, which is height, is modifiable, something that we can change with diet. Usefulness of vegetarian and vegan diets for treating type 2 diabetes. This study was co-done with Neil Barnard, and what he found is that people that had, backed up too soon. He found that vegan diets actually treated diabetes and treated them very, very well. He also studied this advanced cohort, and what you can see here, you have on the left type 2 diabetes prevalence, and then you have types of diet. Of course, the non-vegetarians, pretty high, 7.6% of diabetes. And as you go across the board, the vegans had the lowest at 2.9, and then you gradually go up and up. So this data clearly shows diet is related to diabetes. You can extrapolate that a little more and compare it to BMI, and they almost mirror each other. They're almost the same exact graph. Body mass index is higher in the people that eat everything, and their diabetes prevalence is higher as well. So complications of diabetes, why do I care? Well, cardiovascular disease, about 68% of people with diabetes develop cardiovascular disease. They're going to be needing bypass surgery potentially, or a stent. Problems in kidney function. 40% of people with diabetes have that. It's a leading cause of renal failure. If you have renal failure, you need dialysis access, which is surgery, potentially a renal transplant, which is surgery as well. And neuropathy. 60 to 70% of people with diabetes in their lifetime will develop neuropathy. It's a loss of sensation. You have neuropathic pain, burning in your legs. You can't feel your feet. Because you can't feel your feet, you're stumbling over things, falling. You have complications of falling. And then lastly, infectious complications. When your nerves in your feet don't work well and you stub your toe, you can develop an infection and not know it. Not only that, but you can't get your infection-fighting cells to that infection, and this becomes a very deadly, life-threatening infection. This is a patient of mine that came in with diabetes. He stubbed his toe, came in a couple days later with a very bad infection with a flesh-eating bacteria. Diabetes puts you at risk for this flesh-eating bacteria. Oftentimes, you have to do extensive debridement, which is cutting those tissues away. Sometimes you have to amputate, and sometimes you do everything, and these poor patients still succumb to the infection. So it's a very serious thing, and something I feel very passionate about. This is another study done by Neil Barnard, of course, on diabetes, and what he's showing here, hemoglobin A1C levels. These are measurements that we use for how well your blood sugars are controlled, how well your diabetes is controlled. And he's looking at these hemoglobin A1C levels. He had 2 groups of patients. One was conventional, standard American diet is the line on the top, and then the one on the bottom is the vegan diet. And you can see the patients he put on the vegan diet had quite a bit better improvement in their A1C levels, therefore better control of their diabetes. So on to number 4. Decrease your cholesterol intake, thereby decreasing gallstones and gallbladder disease. Probably the most common surgery I do is removal of gallbladders. I remove gallbladders because there's gallstones in there, because gallbladders aren't contracting right. Gallstones, the majority of them are cholesterol. They're formed by cholesterol from an imbalance in cholesterol. This is a gallbladder I took out. And you can see pretty big stones there. This is the gallbladder cut open. And what happens is these stones form, and then they lodge themselves in the gallbladder, in the opening of the gallbladder. The gallbladder squeezes, tries to contract. It can't. Squeezing against a closed valve. It's very painful, leads to infection, inflammation, and ultimately urgent surgery. Vegetarians have little to no cases of reported gallstones. Why is that? We don't have the same cholesterol intake and imbalance of cholesterol that causes the cholesterol to precipitate out and form these gallstones. And just some review for those of you who didn't go to medical school. Manufacturing a gallstone is a pretty complex process. You have 3 different types of cholesterol, bilirubin, all this stuff that's recycled in your body, and you end up forming this gallstone. So all in all, gallbladder disease, gall problems with gallstones is pretty preventable, easily preventable with a whole foods plant-based diet. So we're on to number 3. This one I think is important. There's a lot of people in the US today that are undergoing joint replacements. They have degenerative joint disease or osteoarthritis, and they need to undergo this surgery. Osteoarthritis has been directly linked to inflammation. And if you eat a diet that has that is not a promoter of inflammation, you're going to have a lower need for joint replacement. Here's a study that was just published. Whole foods plant-based diet relieves the symptoms of osteoarthritis. And like I said, it's all about the inflammation. This one's talking about first line again. So these are the doctors out in the front line, the family doctors that are seeing all these patients, prescribing therapy. This paper's saying, why don't you try prescribing nutrition and physical activity as a first line intervention for people that have this osteoarthritis? Osteoarthritis is tough. Joint problems are tough. You have physical inactivity because it hurts to move. And then you have it compounded because you've altered biomechanics. If you have one bad knee, you're going to be favoring the other knee. And pretty soon you're going to have your whole body alignment is messed up because you're favoring one knee to save putting stress on the knee that's injured. And then you're getting osteoarthritis perpetuated. You get psychosocial disability. You don't want to be out. You don't want to be out with your friends because it hurts. It's in pain to go out. And oftentimes it's linked with being overweight, being obese. When you're overweight, it does hurt to put weight on those joints. Pro-inflammatory again. This osteoarthritis is pro-inflammatory. And it's this self-perpetuating cycle. Hard to break, hard to get out of that. But studies show a plant-based diet will do it. So we're on to number 2. This one I find is very important. It's a little superficial of me, I know, but I find it very important. And this is having more radiant skin, feeling your best, and having more self-esteem. To me, this is one of the most important things we can do for quality of life, if not longevity. We heard Jeff talk a little bit about acne. Acne is a diet, or is something that is caused by a pro-inflammatory diet. Here's a study that I just pulled up that talks about different foods and are they established as a causative factor for acne. And some things, like a high glycemic load diet, absolutely yes. Dairy, so skim, chocolate, total milk, absolutely a risk factor for that. Chocolate's inconclusive, which is probably a good thing because there's a lot of chocolate lovers out there. Salt, iodine, no. And saturated fatty acids, even though it says inconclusive, I'd argue to say that there is a causative factor. Anybody know what surgery this is? Yeah, liposuction. Liposuction sucks out our fat cells that are in our subcutaneous tissues. People go through this surgery all the time to try to look better, feel better. The truth of the matter is you can avoid the scalpel, you can avoid surgery by changing your diet and your lifestyle. You can even further extrapolate this with facelifts, people that go under the scalpel for breast augmentations, things like that, I would argue that you can feel better about yourself by having glowing skin, undergoing this plant-based diet, and avoiding the scalpel, as far as all this is concerned. The last way, the number one way, and one thing that I find very, very exciting is a new word. It's called epigenetics. Anybody know about epigenetics? A little bit? It's kind of fascinating. This is where a lot of the new research is. What we're finding is decisions that we make today affect our progeny. So what I decide to eat today is going to affect the health of not only my children, but my grandchildren. That's a pretty powerful thing, and something that we can easily influence. Dictionary definition, here it is for you. Epigenetics, the study of changes in organisms caused by modification of gene expression rather than alteration of the genetic code itself. So this is not changing our genes as far as changing the DNA structure. What it is we're changing how we express our genes, which proteins are expressed and which ones are not. This field is fascinating. We're finding epigenetic aberrations that occur early in carcinogenesis. That means we're finding changes in how our proteins are expressed that triggers cancer. So for us, when we're trying to treat cancer, this is totally exciting because we're finding new targets, new strategies for treating our cancer as well. When we're looking at epigenetic mechanisms, it's kind of a pretty fancy slide. But what we're looking at is where we can affect things with manipulating epigenetics. We can manipulate things in development. Environmental chemicals are going to manipulate it. Drugs, pharmaceuticals are going to manipulate it. Aging, diet, all of that is going to manipulate how and what proteins we express from our DNA. Targets for that? We're looking at endpoints of treating cancer, autoimmune disorders, mental disorders, diabetes. What's so cool about this is, like I said, it's transgenerational. This is a study that was done. What they did, these researchers found this town in Sweden, Överkalix, Sweden. Never been there. I don't know much about it, except it's in this paper. Anybody been there? No? Okay. I'll meet somebody someday that's been there. In any case, what they did is they studied this town because in the early 1900s, they had a severe famine, meaning these people fasted. Not by choice, mind you, but they fasted. And then they studied their progeny, their children and their grandchildren, and wanted to know what health effects happened. And what we found was pretty staggering. The grandsons of the people that were starving had a lower incidence of heart disease. This was controlled. Another population where food was plentiful, they didn't have that. They had the regular mortality and heart disease. So what they're suggesting is that this fasting from way long ago affected the health of these people's grandchildren. To me, that's fascinating. And it's empowering. It's knowing that what we are doing now is really affecting everything. Our offspring, our offspring's offspring. So we're already looking at cancer targets, molecular targets for this epigenetic therapy. Pretty fancy stuff. This review paper talks about it. Talks about key points of what we found in this study. A lot of fancy words, mind you. So I'm going to help you out. I'm going to replace a few things. This compound here, I'm going to replace with the pro-inflammatory pathway is going to be involved in epigenetic activities. And then what I'm going to do is I'm going to take broccoli and put it everywhere it said ITC, because ITC is broccoli sprouts. That's the chemical term for broccoli sprouts. So what this paper essentially is saying is you're inhibiting this cancer activity with broccoli, and a pro-inflammatory pathway is epigenetically involved by broccoli. And then we got one other thing here, this chemical. We talked about it earlier briefly. EGCG, green tea. So if you're looking at green tea as well as a chemopreventative approach for cancer via epigenetic mechanisms, We've got the data right here, and it's really exciting, really fascinating stuff. So those are my 10 ways. I want to take 1 minute just to kind of recap and briefly talk about something that is coming to my attention more and more as well. You guys being here are more than likely the choir, right? I'm preaching to the choir. You guys know this stuff for the most part. We're very powerful with our influences, with setting examples, and with our judgment as well. Sometimes vegans can be mislabeled as being very judgmental people. Thinking, oh, well, this person has a steak once a week, the rest they're vegan. No, they're not real vegetarians, This judgmental thing, to me, is something that has to stop. And I feel like in order to include more people into the fold, into the group, we need to be a little more accepting. Meet people where they're at, and then gradually, by example, have them come in to a closer understanding and changing their lifestyle that way. The other thing too, like I said, we're a powerful group. We can vote with our dollar. We can buy things that matter. One really good example of this is the non-dairy milks. I remember even a few years ago, you go into a grocery store, you have milk and you have soy milk. That's probably it. If you're lucky, you can find a soy milk. Now, because we have demanded it, you can walk into almost any store. You got almond milk, you got flaxseed milk, you got chia milk, you got whatever you want. And that's because we have asked for it. And this applies to everything, everywhere you go. Every time we fly on an airline, we call and we say, we want the vegan meal, and they laugh at us. It doesn't matter. It's the fact that we're being noisy and telling them, this is what we want. This is what we demand. This is important to us, and it will slowly change the world, just by us with our activism, with our dollar. So to me, that's very, very important. I just want to close by saying everything is related. Everything, I can't talk about one thing without talking about another. Obesity is going to be related to a low-fiber diet, which is related to constipation, which is related to hemorrhoids, which is related to diverticular disease and cardiovascular disease and all these other diseases. They're all related, all intertwined. Lastly, a quote by Michael Greger, whom I respect quite greatly. He said this, patients won't improve their diets or stop smoking, even if it's going to save their lives. So why bother? Why bother? That attitude may be one of the leading causes of death. Meaning me as a doctor getting complacent about me saying, oh, my patients are never going to change. My attitude is a leading cause of death. And the same goes for us. We need to really not have the attitude that, oh, well, so-and-so says they're not going to go vegan or eat whole foods because they can't deal with the fiber. I get that a lot. I have a lot of people say, oh, yeah, I could eat vegan, but I can't deal with the fiber. Fiber's the best thing for you. But becoming complacent and saying, well, they're never going to change because they're talking to me like that, that attitude is a bad attitude. So I just want to thank some of these people, some of these greats that I truly respect, who have mentored me and I admire. And I want to thank you guys. Thank you for being here. Thank you for being willing to learn, and hopefully you learned something tonight. So I'll take any questions.
Yeah, hi, my wife's going through gallbladder surgery next week. What should she expect, and how do you live without your gallbladder?
So a lot of it's going to depend on the type of surgery she has, why she's having it. She can expect she's going to need a little bit of recovery. One thing that I'm starting to tell all my patients is to start preparing for surgery. So you're telling me in a week ahead of advance that she's having surgery. You can do so many things in that week. Preferably you want 2 or 3, but 1 week is good. Immunonutrition is what I'm going to talk about tomorrow, and what that is building up your immune system for any sort of stress. So when you can build up your immune system, meaning making sure you're getting your nutrients, the whole foods, the fresh fruits and vegetables, that's going to build things up. It's going to really help with that stress of surgery on her body. And then to follow up with that afterwards, to keep eating, even if she doesn't feel hungry, just to be trying to take in some of those really healthy foods, not the junk foods. A lot of hospitals have junk food, so you want to watch out for that.
She had a gastric bypass 10 plus years ago. So.
Yeah. You're welcome.
Hello.
Hi.
Hi. We've been studying this for the past, we've been studying all kinds of things to do with health and nutrition. One of the foods that's come up is fermented foods. And I know you mentioned keep the salt low,
Yes.
but fermented foods are made with salt and water. What's your opinion on that?
I love fermented foods, and you guys are, I should have planted these questions because I'm going to be talking about them tomorrow as well. Fermented foods are wonderful, and they're very good as far as probiotics, building up your immune system, and also feeding your microbiome, which we'll talk about. I do think they're very valuable. Salt in moderation. The amount of salt that's in these fermented foods is actually pretty low compared to the amount of salt in a lot of processed foods. If you think about hidden salt and things like a can of soup, has a lot of salt, and honestly, probably more salt than what would be in a fermented food.
You mentioned the turmeric and curcumin. How do you take that? I mean, I've seen turmeric on the spice shelf. I've seen
Yeah.
curcumin in a health food store. I don't know if you take it as a supplement. Do you buy it, the product, and put it on food, or how do you
Yeah,
eat
so
it
I
and
am
use
a
it?
big advocate of whole foods. Yes, you can buy the supplements, but I do feel that putting the fresh turmeric root is better than anything. So it can be grated on salads. You can put it in your smoothie. You can put it in your dishes at night. You can put it on top. The one thing about turmeric as well, and I should have mentioned this during my talk, is if you combine turmeric with pepper, black pepper, it actually exponentiates the effectiveness of turmeric. So if you're going to put turmeric on your salad, also grind some black pepper on there. You're going to get a lot more bioavailability, about 10 times. So fresh root is how I use it. I grate it. Smoothies is one of the things I love to put it in. It's probably the best way to get it.
My question kind of follows up on that. I wondered, because I know in Indian culture there's a lot of turmeric and it's all powdered turmeric, and I would hazard to guess that an awful lot of people here don't live where there's a supermarket that has fresh turmeric year-round or even very often.
Yeah.
But so I'm just wondering, do you know of any studies that show that fresh turmeric is actually better than the powdered turmeric?
No, there's no studies that show that fresh is better. The powdered turmeric is just fine. The one thing you want to be careful about with the powdered turmeric is you want to make sure it comes from a good source, because a lot of times we're not sure that this turmeric isn't contaminated with some other, heavy metals or that sort of thing. So you want to make sure that the place you get it is a good source, but otherwise powdered turmeric is just fine. Yeah, real quickly on that too, it was brought up that it's kind of like horseradish. You can freeze the root. So you can have turmeric, you can freeze it. The other thing is turmeric root keeps forever. It keeps in my fridge for about a month without going bad. Ginger too, same thing. Thank you.
On the same note, you had mentioned milk thistle and grapeseed. What are some practical ways you can incorporate those into your diet?
So milk thistle, the best way is going to be a tea. You actually buy dried milk thistle and you make an herbal concoction with it. That's the best way to get it. You can buy supplements as well, which is essentially ground up milk thistle, put in a capsule, but tea is how I would recommend to do that. And I'm sorry, the other, grapeseed extract, again, that's one of those where in order to get enough grapeseed, you're gonna have to eat a lot of grapes or drink a lot of wine, and that's not very practical. So it's one of those things where you can concentrate it down and buy a jar of grapeseed extract that's put in a capsule form. And most of the studies that have been done on the anti-cancer stuff has been done on the grapeseed extract capsules. Yeah.
Another turmeric question. What would you say is would be an adequate amount to take in? Is it like a moderate sprinkling at 3 meals going to be okay? What would you say would be like an approximate amount that would make a difference in like a daily diet?
So that's a really good question. I would say 3 times a day might be a little overkill. From what I've found is, just a root, so they're about like that thick, and about that much turmeric is what I would put in my meal. Most of the studies have been done on turmeric capsules or the curcumin, and that's going to be 1 capsule, which is over 1,000 milligrams in 1 capsule.
I was wondering, what are your thoughts on the PSA blood test as an indicator of prostate cancer in men?
That's opening a can of worms. The PSA blood test is not very specific, and honestly, I wouldn't use it as a screening test, but that's my personal opinion. There's many opinions either way, but I don't feel that it's a good screening test. And actually, a lot of the guidelines are coming out saying that it's not the most specific test. There's a lot of reasons for it to be false elevated. Even if a doctor does a rectal exam the day before or the same day to feel the prostate, your PSA goes up, which can trigger false biopsies and a lot of unnecessary procedures.
Would you please address organic versus non-organic and GMOs?
That, again, is a can of worms. If I were given a choice, eat no vegetables at all or eat non-organic vegetables, I would pick non-organic vegetables every time. That being said, given a choice, organic versus non-organic, I would pick the organic. There are a lot of pesticides that we know are hormone disruptors. The corn, for example, the BT protein that's in corn is one thing that is very interesting that's been studied, and that is actually a genetic modifier. And what happens is you can't wash that off. That's a GMO corn, which you're putting in your body. And then you are having this BT protein, which actually interacts with your microbiome, so the bacteria in your gut, that's going to cause alterations. And it causes the actual expression of the bacteria in your gut to change. So yes, we're finding out that things are not that good. The GMO stuff, the Franken foods, I really recommend to try to stay away from, if at all possible. But that being said, given the choice of no vegetables at all versus those, I'd probably choose those. Does that make sense?
My question is about supplements you mentioned. First is B12. I got tests, blood test, and shows B12 low. I am 7 years vegan, and my B12 is low according to the blood test. And so I am taking B12 pills. The other thing is more serious. It's about the statins. Statins lowers cholesterol for sure. But as a vegan, I got 120 cholesterol total, what is lower than 150 that starts the reversal. And my doctor said I should continue taking statin, Crestor, 5 milligrams, 3 times a week, even if I have 120. I asked why. He said that Crestor has anti-inflammatory action. So you should take Crestor not to lower cholesterol, but to have anti-inflammatory. What is the alternative to have anti-inflammatory without Crestor? Thank you.
Thank you. I'm hoping you hear more about that this weekend. You're absolutely right in a lot of that research with the statins showing that they're anti-inflammatory. That being said, there are other ways to achieve an anti-inflammatory state. You don't need to take the statin. Statins are one of those things that, unfortunately, when they're prescribed, you stay on them for the rest of your life. Your doctor oftentimes doesn't question, oh, we should take you off the statin. You're on a statin, you'll always be on a statin. And that's unfortunate. I'm assuming and I'm hoping over the weekend you're going to get more specific data based on your question. Prescribing statins is not my level of expertise. I know enough about them to know that they are anti-inflammatory. They do lower your cholesterol, but there's other ways to go about them for sure. And your other question, I'm sorry. The B12, yes. The B12 is one of those supplements that as vegans we actually should take. It's one of those things we have to take. B12 back in the day used to be on the dirt in our vegetables, the dirt that we used to have, and we'd eat dirty vegetables and get our B12 that way. These days, no. Our vegetables are too clean. The soil's depleted, so even if we do have dirt on there, we don't have all the B12 and nutrients we need. So B12, we do need to supplement. And being B12 deficient is a big deal. It alters a lot of your gene transcription. It alters your immune system. It is a big deal. So that is something I absolutely agree with, and everybody actually should be taking a B12 supplement if they're vegan.
Have you had any success with getting Hawaiians off of Spam?
That's going to be in my talk tomorrow, too. I'm actually working on it. There is a guy by the name of Terry Otani. I don't know if you've heard of him. Shintani, I'm sorry. And he's been doing a lot of work on that as well, and he gives talks. He actually used to have a very small little lunch that he put in our convenience store over there called Zippy's. I don't know if you've been there, but it's a store and they sell a lot of fried food and Spam, musubi and everything else. And he had his meal right next to the other ones, and people bought it. It was actually a really good thing. It would be nice to continue that. Getting them off of that is very tough. The Queen's Hospital where I work, we have an affiliation with the Dean Ornish program. So we actually have a lot of patients that come and they rehab or they prevent their complications from cardiac disease with the Ornish diet. And also, Ornish has a chef that has produced a lot of recipes in Hawaiian style. So instead of the Spam musubi, he had a musubi, I believe, with a sweet potato on there or something, and it actually was very tasty. So a lot of these traditional recipes that Hawaiians love, we're redoing, and hopefully that's going to make a big difference. Yeah.
Thank you very much, Dr. Van Dyken. That was fascinating.